Thank you for joining our webinar this afternoon. I'm Caitlin Crossley from Optimity Advisors, and I'll be your moderator. Niamh Lennox-Chugani will be presenting. This webinar is about how to embed rapid cycle evaluation. Before Niamh starts, I'd like to introduce today's speaker, explain how to ask a question using GoToWebinar, and finally, how to access the webinar recordings. Niamh has 25 years of experience at senior levels in health provision, commissioning, policy making, and research internationally. Her profile is available on our website, or you can find her on LinkedIn. Today's webinar, How to Embed Rapid Cycle Evaluation, is the fifth in a series of 6 webinars we will be hosting on evaluation methods. If you'd like to listen to our past webinars, please visit our website. Before we get started, I wanted to mention that we welcome your questions throughout the webinar. All you need to do is type your question into the questions window, which for some is the 6th blue bar down on the GoToWebinar control panel, and hit submit. We'll get to as many questions as we can during the Q&A session after the main presentation. Finally, we're recording today's webinar and we'll post it on the Optimity Advisors website. We'll send you an email once it's up in case you would like to watch it again or forward it along to a colleague. That's all from me for now. I'd like to hand over to Niamh.
Thank you, Caitlin. So this webinar today is about using improvement science methodologies to develop fit-for-purpose evaluation frameworks to support transformative change of new models of care. We're going to answer key questions today, such as what is rapid cycle evaluation, why it adds value, and how it differs from traditional evaluation approaches. We'll share the principles underpinning our framework for rapid cycle evaluations and how these are critical to the new innovations in healthcare. For example, new models of care, vanguards, pioneers, and test beds. To illuminate these principles, we'll give examples of how this has been done at a large and a small scale. And finally, we'll focus on the key challenges of rapid cycle evaluations. I think what I would say as a starting point is that programs, the kind of things that we're all involved with for transformation, are essentially theories or real-life experiments that need to be tested rigorously throughout the program. And that's the basis for today's discussion. So rapid cycle evaluation is, at its simplest, plan, do, study, act. This is a traditional approach that has been at the forefront of the NHS Institute for Improvement in Innovation, as it was, for quite a long time and has been widely used across the NHS. This is a quality and service improvement tool. We've taken this approach several steps further, and we'll talk about this in a minute. So why is it important? Why do we need rapid cycle evaluation? Well, evaluation needs to feed directly to support change, providing evidence on processes, outcomes, and impacts to shape decision-making. Evaluation provides a balanced, critical viewpoint to feed back information for decision-makers to act on the information in real time and make changes that are necessary. This is an ongoing cycle. Evaluation should embed rapid cycle evaluation by co-designing evaluation programs with the localities or programs to understand when and how the rapid cycle evaluation should be integrated. Evaluators need to think about what data is essential to enable people to make decisions and changes, not just quantitative data, but qualitative data as well. There'll be more on this in our webinar in May. Rapid cycle evaluation helps localities or programs evolve interventions to better meet the needs of the population it serves and to ensure that it is done in an efficient and effective way. This involves working with lots of stakeholders closely. And finally, this approach is very valuable because we are at a point in the NHS where we can't afford for initiatives to fail. A lot of money is being invested in new programs. This is an opportunity to capitalise on making those improvements through your evaluation. For example, the testbed sites have a lot of upfront costs and multiple partners. There are so much investment upfront for technology. Everyone wants to succeed, and the best way for it to succeed is to include rapid cycle evaluation approaches. So typically, traditional evaluations are formative at the beginning of a programme or summative at the end of a programme, often with fixed, rigid time points. However, decision makers may need data quicker than that. Rapid cycle evaluation is different because you're inputting to the programme on a regular ongoing basis and the information collected is slightly different. Rapid cycle evaluation lends itself to a realist evaluation framework. Realist takes on board contextual and external factors that you may not be able to control that are going to impact on the intervention. It's based on work by authors called Pawson and Tilley, and if you would like more information on Pawson and Tilley, we'd be happy to provide it. And this approach tests program theories systematically throughout the process with the purpose of refining them in the context of the real-world application. Our approach to rapid cycle evaluation is also based on our wiki management model. The principles of this underpin our approach to rapid cycle evaluation. Together, these disciplines and approaches characterize the most innovative and high-performing organizations in the world today, including in health and care. And based on these disciplines, we've applied this to how we approach new models of care through new ways of working. It's really important that as part of rapid cycle evaluation, the aim is to build an operating model for organizations and systems that learns through constant feedback and is able to integrate information to be more agile in anticipating the rapid changes in demand that we're experiencing in healthcare. We utilize an improvement science-based methodological approach for designing and implementing change projects. We've taken this and embedded it into our evaluation approach. This complements whole system transformation with evaluation, an essential link to achieving change and impactful evaluations. This is based on our experience in delivering this approach in the UK, mainland Europe, and the US. This approach delivers value for money using an innovative co-productive approach to situation analysis, solutions design, data collection and analysis, and rapid cycle evaluation to inform an ongoing plan of development and implementation. The assumption underpinning this approach from an evaluation perspective is data and information is needed by the evaluation at certain points to support decision-making around the further development of the intervention. Organisations have the capabilities in-house to know what they need to get out of an evaluation, and they need to work collaboratively with the evaluation team. Evaluation should foster an openness to learn from mistakes. This is the only way to improve sustainability and requires transparency in the evaluation data. Accountability through evaluation that is more meaningful to us all is not up and down, but works peer-to-peer. We learn effectively from one another. Using this model, evaluation programs can build a framework of the baseline picture of the current state of the system and assess to some degree whether they are ready for evaluation. When this is applied to rapid cycle evaluation for new models of care or vanguards, the phases illuminate how an evaluation program should be structured and the questions the evaluation team can consider. An intervention goes through different stages. Evaluation can and should be embedded throughout. At the ambition and motivation stage, background information needs to be considered, such as what is the vision and narrative, what kind of leadership and management practices are in place. In regards to design, the evaluation needs to assess whether the program was fit for purpose, through looking at governance and accountability, the operating model, and financing and incentives. This is founded on a logic model approach. My colleague Jackie Melender talked about logic models in an area webinar if you'd like more information. At the delivery stage, evaluation is focused on process. Was the intervention successful? What did the workforce say? What practices were innovative or collaborative? And at the improvement stage, the evaluation needs to consider how the workforce has acted out the change through learning from mistakes, measuring what matters, and being accountable to each other. Using the framework we've just discussed as a guide, you can create a rapid cycle evaluation that is targeted, tailored, and useful to the intervention's objectives. In a 2-year evaluation program, for example, evaluation at a minimum should be fed in quarterly. It needs to be a joined-up approach, running in parallel with the local transformation program, interlinking at certain points. This hasn't traditionally been done, but it enables the program team to learn, or, as in PDSA, study, and act on this information, modifying the program accordingly. So there are some practical ways to use rapid cycle evaluation, and these include workshops. So facilitated workshops where everybody can be in the same room at the same time to harness collective intelligence is one of the most powerful resources at your disposal. Co-design sessions can be equally collaborative in terms of designing sessions. What I would say, though, is that both of these need to be clearly structured using research questions, evidence hierarchies, and a clear evaluation framework to get the most out of them. Qualitative and quantitative information can be used to create action learning sets to stimulate discussion and innovation. Again, this needs some structuring and facilitating, but not so much that you risk inhibiting creativity. Virtual conferences and webinars are another technology enabler of sharing knowledge across a system, and interactive webinars have been used successfully to share and disseminate knowledge across a broader system. If you are using written reports, keep them short, use visual information where you can, be clear about what is working and what isn't, and how you're learning from the information that you're gathering. Use as many channels as you possibly can to present this information in a way that's meaningful and can be absorbed by the people who need to hear it, people who are often incredibly busy. And a very practical hint, which is press record. Record meetings. Listen back to them, enable other people to share in meetings where they can't be physically present. Again, this can be incredibly helpful in terms of sharing information. And finally, something that we use effectively where we've worked is what's called a Scrum meeting. This has come from the technology sector, where they use Scrum meetings to be agile and responsive in terms of learning, facilitating Scrum meetings on a daily basis to share learning about what they need to do, how they need to solve problems collaboratively. These are typically no more than 10 to 15 minutes long. Everybody stands, nobody leads the meeting, and nobody controls the meeting in terms of the agenda. But anybody who has a challenge shares that challenge with the room and welcomes all support. So on to some examples of where we've seen the benefits of rapid cycle evaluation. We've selected 2 examples today. One is large scale and the other smaller. So this first large scale example is from the US. The Center for Medicare and Medicaid Services Innovation, their partnership for patients is a public-private partnership working to improve the quality, safety, and affordability of healthcare for Americans. 2010 to 2014, we provided support to the national content team. This involved program evaluation and content development support for the public-private partnership over 3,200 hospitals. This project used rapid cycle evaluation through the hospital engagement networks to identify best practice, rapidly implement these, and evaluate the outcomes. Best practice was gathered through rapid evidence assessments, and evaluation of the outcomes was done by an independent third party. Lessons learned were shared using webinars, facilitated by support teams, and a dedicated website. So the outcomes and the findings of this project were that 50,000 fewer patients died in hospitals and approximately 12 billion in healthcare costs were saved as a result of a 17% reduction in hospital-acquired infections from 2010 to 2013, with an associated 150,000 fewer readmissions. But the benefits of the rapid cycle evaluation model were that there was an ability for the programme to adapt their focus to deliver greater benefit through the cycle of the programme, and to share learning about greater impact in certain areas across a wider system of actors, which allowed lessons learned to be learned far quicker than through a summative evaluation. On a smaller scale, the Supporting Young Adults project, which was part of NHS Kidney Care National and International Multi-Site Evaluation, was a project that constituted 6 renal networks across England. They developed and implemented a range of models of care to improve transition and support in adult services for young adults with kidney disease. The aims of the 2-year evaluation programme were to explore the different models of care, explore the influence of the models of care on outcomes, reflect on the feasibility of delivering different models and approaches, and identify drivers and barriers to achieving a smooth transition process and improved support. To achieve these aims, ongoing learning and challenges throughout the project were captured and fed back at learning events and working groups. At these events, formal presentations were delivered that highlighted the highest priority issues for resolution. Through facilitation, all networks worked together to problem solve, as some areas had a similar issue that others may have already resolved. In addition, short interim reports to each network were produced to indicate their individual performance. These were taken to their individual boards, and groups were created to solve any issues before reporting back on progress. This is a similar approach that was used to evaluate Health Education England's Better Training, Better Care programme in 2013-14. So what are the challenges to using rapid cycle evaluation? Well, one example is if you're using a rapid cycle approach and the intervention is changing and evolving, there's a question about how that impacts on your evaluation itself. If you set out to design and implement an intervention with a view to improving secondary care utilisation, patient clinical outcomes or self-management, for example, these shouldn't be changing, so you should still be collecting the same data. What needs to be more flexible is if processes change. These changes need to be captured and ensure that you're still measuring the right things in terms of processes and any unintended consequences. And going back again to the logic model, which I referred to previously, the way that I would position that in terms of the logic model is the outcomes and impacts shouldn't change because of the process of rapid cycle evaluation, but the processes and activities through which you wish to achieve your outcomes may do. I'd like to hand back over to Caitlin now, who will take your questions.
Fantastic. Thank you very much, Niamh. We've received a few great questions so far, but as a reminder, if you have a question you'd like to submit and you haven't yet, there's still time. Just type your question into the questions box on the GoToWebinar panel. Niamh, the first question we have is, with increasing resource constraints, how can we make the business case to do a resource-intensive evaluation program?
So I think the answer to that, not surprisingly from somebody who's spent many years as a researcher, is that the business case in many cases is already made by an approach to program and transformation delivery. So program management, good practice program management itself builds in evaluation to the cycle. And a really good business case for any transformation should have set out explicitly what the benefits of the transformation are going to be. And I know that's been a message that has been very clearly articulated by the new models of care program around the value proposition and logic models for the Vanguard programs and for the new models of care program as a whole. The importance and then centrality of measuring to those benefits and measuring to those outcomes is absolutely central. And I would argue, and I would challenge anybody to, at this point, argue oppositely, that to not evaluate a program probably puts you in a position of being unable to substantiate and support the business case itself. I would argue that the business case positions you such that you have no choice but to evaluate. The importance is in how you evaluate and who conducts that evaluation. So there are different arguments, I think, for whether an evaluation needs to be independent. And I think that really depends on the scope of the evaluation, the purpose of the evaluation, and the availability of a local internal skill set. Equally, I would say that it depends on, I would say that even if it is independent and external, there should be a degree of skills sharing in order to ensure that the principles of embedding learning across the system are adhered to.
Okay, great. Thank you, Niamh. The next question we have is, how is rapid cycle evaluation different from monitoring?
I actually don't think there is a difference between these two things. I think language is used differently depending on the perspective that you come from. I spent many years working for international aid organizations that used evaluation and monitoring as the framework for how good program evaluation is conducted and good practices around those things. And one of the elements of evaluation and monitoring, one of the potential approaches, was always rapid cycle evaluation. And one of my key learnings in that environment was around the importance of involving local stakeholders in your rapid cycle evaluation, in particular engaging in participatory approaches with users of services. So actually I think these terms can be synonymous. I think what differs rapid cycle evaluation is it has a very clear timeline, a very clear approach. It is transparent and it involves the people who are delivering the program as well as the people who are conducting the evaluation.
Okay, great. The last question we have is, earlier you mentioned how rapid cycle evaluations can link with local transformation program. But what makes a traditional evaluation program less compatible to linking with a transformation program?
So what I would say there is that many traditional approaches to evaluation tend to be summative, so they occur at the end of the program. And many of them are also retrospective. And that's not always the case, but to a large extent it is the case. And whilst they have a really important role in evidence gathering, they don't inform implementation in quite the way that we've talked about today in terms of rapid cycle evaluation. And they don't enable a program to learn quickly and iteratively through the cycle. What I would say, though, is that these sorts of evaluations absolutely should be included at the beginning of a program during its design as the evidence for the case for change. So they do have huge value, and there are a large number of them going in, many going on at the moment, many of them being conducted by academic centres, and we shouldn't lose the value of these programs.
Okay, great. We've actually had one more question come through, and since we still have time, the question is it important to work hard to limit disengagement from the rapid cycle process? Because presumably it requires additional effort from local implementation teams.
I think this is certainly it is a challenge. It's a challenge for the program teams, full stop, I would say. It's not just an evaluation challenge. I think when you're dealing with a transformation program that happens over an extended period, particularly where the transformational change can be, the feeling of change can be slower than people anticipate, that is a challenge anyway. What I would say is actually rapid cycle evaluation enables you to keep some energy and impetus going, because it's a method of constant feedback through the system. So you have a way which makes to all the people engaged, all the stakeholders engaged in the change, makes the process of change visible and transparent to everybody. And you're sharing it in an innovative and different way from the way that they're traditionally used to. So actually, I would say a rapid cycle evaluation approach can help with that engagement.
Great, thank you, Niamh. Well, we've run out of time. If we didn't get to your question, feel free to email us and we'll follow up with you directly. The recording of the webinar will be available within the next 48 hours on our website. Our last webinar in the 6-part series is on the 18th of May at 1 p.m. with Gareth Harper. This webinar will focus on how to design a minimum data set for evaluation. Thanks again for joining us, and we hope you'll be back at the next Optimity Advisors webinar. Thank you.